Good morning. We continue with our VTE awareness series, and today we discuss how doctors manage the deadly blood clots. Once you are diagnosed with a clot, whether in the leg, DVT, or a clot in the lung, or any other part of the body like the brain, we use drugs called blood thinners. The medical term is anticoagulants. Blood thinners, these are drugs that stop the body from forming new clots. They do not break down the existing clot, so they prevent the clot from getting bigger and also forming new clots. And then the body's own mechanism breaks down the clot. We have various forms of blood thinners that we use, anticoagulants. We have the injections and the drugs that are taken orally via the mouth. For the injections, they are called the heparins. We have the ordinary heparin, which is given as an injection. You need to be admitted. It's given 2 times or 3 times a day, or as a continuous infusion. This works very fast, the ordinary heparin, which we call unfractionated heparin, and someone must be an inpatient to use that drug. The main risk of blood thinners is that they can cause bleeding because they prevent the body from forming new clots. The second type of IV medications are the low molecular weight heparin, which is what we commonly use, called enoxaparin. Enoxaparin are slightly safer than the ordinary heparins, but more expensive, and this is the standard of care of management of clots in pregnancy. So if you are pregnant and you have a blood clot, you will be on injectable medications because the oral medications are not safe in pregnancy. The enoxaparin is what we commonly use and given as a twice daily injection, but can also be used once daily as per your doctor's advice. The main drugs for management of clots as an outpatient are the oral medications. And the oral medications, we have 2 types. We have the older warfarin. This has been used for many years. The warfarin blocks vitamin K and prevents the body from forming new clots. However, it has many side effects. It interacts with very many foodstuffs. If you're on warfarin, you are told not to take the green vegetables. It also has very many interactions with other medications. So warfarin is no longer the standard of care of blood clots, except in some special circumstances. For example, patients with heart valves, patients who are breastfeeding can use warfarin, or rare clotting disorders like antiphospholipid syndrome. So warfarin is no longer the first-line treatment of blood clots. The first-line treatment of blood clots are what we call DOACs, direct oral acting anticoagulants. And we have a number of medications that we use. We have rivaroxaban, apixaban, dabigatran. These are very big names, but the key thing to remember is we have newer drugs that we use, like rivaroxaban. These drugs are taken orally. Some are taken once or twice. They do not require any regular monitoring, and they have less interactions with foods and other medication. So if you are diagnosed with a clot currently, we put someone on those DOACs. This is the standard of care, and commonly rivaroxaban, which is taken once a day, does not require to be used with heparin. You can just start on the treatment as an outpatient. For all patients on blood thinners, you need to remember that there is high risk of bleeding. So if you are to undergo any surgical procedures, any tooth extraction, your doctor needs to be aware you are on blood thinners. So that is how we treat clots. Very rarely, for patients with extensive clots, extensive DVT, massive pulmonary embolism, we use drugs called thrombolytics or clot busters, drugs to break down the clots. These drugs are given in massive pulmonary embolism or massive extensive DVT, thrombolytics drugs to break down the clots. How long will you be on treatment? Ordinarily, you are on blood thinners for 3 to 6 months. But if you have recurrent embolism, if you have high risk or an ongoing risk factor, the treatment may be indefinite. So routine duration may be 3 to 6 months on the blood thinners, or indefinite for people with high risk of recurrence. The key thing to remember always is to follow your doctor's advice, and then remember the clots are treatable. We need to diagnose them early, and then once they are diagnosed, your doctor will put you on the blood thinners. Follow your doctor's advice. Stay tuned for tomorrow's post, where we will discuss life after blood clot. We will discuss the post-thrombotic syndrome and post-pulmonary embolism syndrome. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.